If you were in your 20s today, what business would you build?
Nutra. I think I started Botanic when I was 22. Knowledge is all about sharing. If I'm educating my consumer, how do you know this is a true liposomal powder? You will only know if you're doing 10. Not all clinical studies are same. I'm spending $100 on these tablets.
True.
And I have a problem that I'm only getting $30 benefit because $70 is coming in a toilet next morning, right? Because I can see the color of my stools. And that is a problem with iron also.
Right.
Lot of ladies take iron supplements after pregnancy.
Yeah.
The basic problem with the ferrous sulfate and iron supplements is you have a constipation and stools are dark. You can see that, but you still take iron. But that's the side effect that you have. Now that is where we come up with the technology. We have patented, we spent a lot of time, 3-4 years into it, really done a lot of R&D, patented a DFS technology, which is dietary fiber stabilized, and we came up with the liposomes. And we decided, we spent a lot of money for 2.5 years. We did not launch a product, but when we launched it the right way. And whole world is telling us, when I say whole world, top Japanese companies, top European companies, top American companies, top Korean companies, they have validated and they are the one who's writing us emails and sending us the data. Guys, hats off to you guys. You guys make the world's best liposomes.
Wow.
And that is where we brought in a technology, because I told my team, man, we can sell botanical extracts, we can sell branded bioactive, but how much? Maybe 500 crore, 700 crore, 1000 crore. But we want to be much more than that. And we want to ensure the consumer is asking, man, I don't want my money in the toilet. I can see my toilet is red, black, yellow. And I really want to make sure whatever supplement I'm taking is getting absorbed in my gut.
Right.
You give me something that will help your branded bioactive to be absorbed in my body fully. At least 90% should get absorbed. 10% may come out, food may also come out, for example.
Right.
But I want 90% at least absorbed. And that is where the LipsoBio was born. So there's a liposomal, bio means botanical extracts, for example. So that's where we launched a lot of products in terms of vitamins. Vitamins, the major problem, B vitamins are unstable. Yeah. Vitamin K2 is unstable, for example, right? The moment K2 combines with magnesium or vitamin C, it becomes unstable, it degrades, for example. So you need to encapsulate vitamin K2. And then you need to encapsulate C or magnesium. Then you do vitamin D3 and K2, for example, right? Otherwise, D3 also degrades. Vitamin D3 cholecalciferol degradation happens the moment it combines with other minerals or vitamins. So encapsulation has been in pharma. You see anti-gastric capsules, omeprazole and others, they are all sustained release. They are all SR grade, for example, sustained release. Encapsulation has been there, but in terms of having a liposomal, what liposomal technology does, the basic principle is, it does a twofold, right? What liposomes do, the main purpose is you reduce the particle size, right? And you change the nature of the molecule by adding a precursor, so the molecule, the active molecules gets absorbed in the body. Right. So the way to explain this is, think about a synthetic cloth or a shirt, or think about a sponge. If you pour water on my shirt, it will not absorb straight away. It may just flow through. But if you put a water on a sponge, it will go through straight away. It will absorb more water, right? What liposomal technology does, it engulfs and binds the molecule and encapsulates it within a phospholipid layer. And then when the layer, phospholipids are easily absorbed in the body because they're not synthetic. The body loves them, right? So once a molecule is encapsulated in a phospholipid layer, then your small intestine, the small structure, straight away absorb it. In some cases, maybe 100% absorptions, right? So that means the $100 that you spent on your supplement, $100 is getting absorbed in your bloodstream and your body. It's not going to the toilet. And that is what consumer wants these days. Right. And by doing that, what happens is, you don't need to take too much of it. You can take half of it, because earlier you were taking 1 gram, 20 gram was getting absorbed in the body, 80 gram was coming out in the toilet, for example, right? 80% is gone, 20% getting absorbed in the body. Now, whatever you're taking in a liposomal format, 100% is getting absorbed in the body. So maybe you don't need to take too much. You can reduce your dose and reduce the cost also, because instead of draining all the branded bioactives in the loo, in the toilet, better you give less of it,
Yes. Right.
but in a better format, in a liposomal format. So it gets absorbed in the body, smaller particle size, body has to do less work, because too much of something is also not good. For example, there is a sort of superstition in people that if you take too much calcium, for example, oh, I may have kidney stones, right? A lot of joint supplements people take, they take glucosamine, chondroitin sulfate, but doctor also gives calcium tablets. Now there is a thing that people think in the market, hey, look, too much calcium tablets, I may have kidney stones, right? So they can take liposomal form of it, right?
Right.
The whole concept is about more absorption and don't load too much into the body,
Right.
because body doesn't like too much of anything, right? And if you don't need to, why to load it? Because a lot of people say to me, yes, but it gets excreted from the body. But hey, but why you want to make your body work to excrete out? So some molecules, let's say glutathione is there or vitamin C is there, for example. Even if you load your body too much, it will come out of the body, for example, right? I mean, through excretion. But for the body to get it out, body has to work to get it out.
True.
But then why you want your body system? It's like you're putting rubbish inside or something inside and telling body, hey, do all the hard work and get it out. When you have a choice to take it in a liposomal format, put less of it, only give what body is needed, and your body doesn't have to do extra work. Because if the body does extra work, it has to use your energy itself in any way. Your organs has to work, your kidney has to filter, your liver has to work.
Right.
So that's the whole concept of a technology, where it's called targeted delivery, to ensure human beings gets the targeted molecules, and then their investment should not go into waste.
Right. So, listening to you, we can say that this is going to be a long-term shift, not the hype. The delivery systems and the delivery technologies like liposomes, sustained release, whatever it is. So, how are you preparing to become a market leader in this?
Well, I think we are already market leader, but I personally believe more education you give to the people. Now, a lot of people ask me, first of all, not all liposomes the same, right?
Right.
Now, when you buy liposomes, you really need to ask how those liposomes were made, how stable they are, what is the particle size, what is a leach test, for example, how much is encapsulated. So let me explain you. The basic model of making liposome is a phospholipid, for example,
Right.
and then the technology, right? So when we've done an R&D, we have spent so much money into R&D, and we tried different things with technology, without technology, doing a lot of stability studies, which one more stable, less stable, for example. A lot of work has been done. And I ask people that when you are buying or somebody is selling you liposomal ingredients, ask them all these questions, and I'm going to sort of lay it down. First of all, the mathematics has to match. Let's say if iron or ferrous sulfate naked one that you get in the market is 400 rupees, the liposomal itself has to be more than 1,000.
Right.
Because if you think about it, you need to put phospholipids, right? Now there also there's a cross-cutting. There is a cheap phospholipids that you can buy in the market, which is from soy lecithin or some other source. Or you can buy very premium phospholipid, very high content of phospholipid loading on 90-95% from sunflower, but the cost difference is 3 times.
Right.
But if it's costly, it also gives you more stability.
Right.
Your molecule itself will be very stable. And I'll tell you some practical examples. So, how much phospholipid loading that you have in your liposomal product, that drives the cost of the product.
Okay.
And then your technology, how are you making the product. So I have done a series of educational material, and our company itself, I mean, I have a lot of people and brain behind it. We educate our consumer, hey, if you're buying a liposomal, ask people, do they have TEM imaging? TEM imaging is like a electron microscope, which can see whether the liposome is formed or not. Now, I can tell you this is vitamin C powder, this is a liposomal. Both are looking similar, white powders. How do you know this is a true liposomal powder? You will only know if you're doing TEM, cryo-EM.
Right.
So TEM is a basic imaging or SEM is a basic imaging. The gold platinum standard is cryo-EM. The sample testing itself is so expensive, for example, and not many people, even we don't do in-house. We send it externally every batch, right? It's so expensive testing that not many people in India has it also, right? So TEM and cryo-EM are the basic standards. Then it comes to the question about Jetta potential, PDI data, how much is your encapsulation efficiency. So if I'm selling you vitamin C 70% liposomal, you need to ask me, Gaurav, you're selling vitamin C liposomal 70%, but tell me how much of 70% is encapsulated. It's not going to be 100%, I can tell you that. So our encapsulation efficiency will be like 70%, let's say, right? So that means 70% of the powder is encapsulated. So if you think about it as 700 mg, if I'm giving you 700 mg or 70%, then only 490 mg is encapsulated. Rest is not encapsulated. I'm selling that product for you at 1,000 rupees, for example. There is another vendor saying, yes, I also make Madam liposomal. You ask a question, man, what is your encapsulation efficiency? I want to test it. If that encapsulation efficiency is only 30%, then that means only 210 mg is encapsulated.
Right.
30% of 70% or 700 mg is 210 mg. If he's also selling you 1,000 rupees, then you need to ask a question. Right. Man, you are telling me a product. I understand it's a 70% liposomal vitamin C, but your encapsulation efficiency is only 30%. So technically, only 210 mg out of 700 is encapsulated. Right. But here I have another vendor which is giving me 80% encapsulation efficiency or 70% encapsulation efficiency. Now my powder that I'm putting in, 500 mg of the whole powder, 80% of the whole powder is encapsulated. It's a real true liposomal powder. But what you are giving me, 70% is non-liposomal, 30% is only encapsulated.
Okay, we got.
So think about it, right? So that is a real science. People need to ask these questions. Not all liposomes are same. And that liposomal efficiency, encapsulation efficiency is driven by what he put in inside her. Right. The person who is putting a cheap quality phospholipid, low quality phospholipid, low LPC value, low phospholipid loading, he will get a less encapsulation efficiency than the person who is using a premium quality phospholipid, but that drives the cost up. Now is the manufacturing, for example. Do you have a manufacturing plant to manufacture liposomes? I can tell you not many people in India has liposomal plant to manufacture liposomes. Everybody just mass mixing only and drying. And some people are doing dry blending saying, we are making liposomes. Well, that's the fundamental questions. I think these days brands should go and look into their raw material manufacturing, ask them solo questions, compare. In India, you can travel. These days, flights are everywhere, right? Go into it, do a due diligence, send your QA team, send people. Better do that way instead of keep paying money on something which may not be a true product that you're buying, right? Then there's a lot of technical things. There's a leach test. There's this. A lot of things are there. And I can tell you an example. There was one of the major brand and big CMO also. They were buying liposomal iron. Obviously, it was a cheaper than our product. We were selling liposomal iron, which was nearly 1.5 times expensive than what we were paying. And they were happy. They said, and I kept telling them, man, look, it cannot be that cheaper. It's something is wrong. And they said, no, we are happy. Product is launched, things like that. It was a liposomal iron shots, right? Now, what has happened is it was a big brand who put the product out in the market. They have satisfied themselves that everything's good, but they have done an accelerated stability study also, for example. After 6 months, the taste profile of the liposomal shots, iron shots changes. It was not a bitter, it was a tasty. People were craving for these liposomal shots, for iron shots. After 6 months, those liposomal iron shots became bitter. And people started sending complaints that, look, our stools were getting dark now. Earlier, when I was taking this product, I was happy. So the
encapsulation is broken.
There you go. So the liposomes burst. And that because the stability was not there. Low phospholipid loading, encapsulation efficiency was not there. After 6 months in the liquid, liposomal formulation gone bad. It turned bitter. When it turned bitter means iron came out. It is not encapsulated anymore. When iron came out, again constipation issue. Again the stools are dark like a ferrous and iron. So that is a major challenge. And then they had to recall the whole product.
Wow. So I think the brands, those are getting into launching any kind of liposomal products. I think we have amazing information right now. There are 5, I think top 5, questions you should be asking to the innovators who are offering you liposomes. One is obviously the source of life, the liposome
Phospholipid.
phospholipids, whether it is soya or sunflower, you ask them. Then there is encapsulation
Efficiency, your
efficiency,
Zeta potential,
zeta potential,
particle size analysis,
particle size
and cryo
analysis,
M
and
and temp, for example. Right?
TAM test. I
Test.
think these are the main 5 parameters. If you cross check before buying this, I think that's a good way to go ahead and finalize that particular
Yeah.
innovator.
The cheap is always not good.
And obviously the price.
So price comes with the quality, but then it's there's an old saying, sasta roye baar, mehanga roye ek baar, right?
Right.
So if you want the right quality product, then it costs money, right?
Right.
But then that is more sustainable way of doing a product, and it works. Trust me, I have seen brands in India who are buying some ingredients from us, very high price.
So I think this is first time I'm listening to such a depth of information from liposome side, and being in industry, still I wasn't aware of all these important parameters while choosing the liposome. I think this is going to be the great content for everyone who is listening, especially from our B2B partners or the brands, companies, and even to the aware, informed consumer. I think let's switch to fun round now, rapid fire episode. I'll be asking you for a few questions. You have to answer in one sentence. Ready?
Yeah.
Choose one ingredient that you truly believe in. It can be botanical extract or it can be anything.
Confit, which is a corn silk extract,
Corn silk extract.
which is a patented and clinical studied.
And for
This is for weight
targeted
loss and
application.
UTI.
One supplement you personally use.
Good question. I use a lot of supplements. But
what's
these
your
days,
favorite?
These days I'm taking berberine.
Wow, for weight loss.
Metabolism and weight loss.
3 things every ingredient brand must stand for.
I think every ingredient brand must stand for their product quality,
Quality,
validation of that quality,
validations.
and making sure that they are getting it sustainably sourced
Right.
all the way. If any brand, any D2C brand in India can make sure their raw material manufacturer and the raw material quality they are getting is fully validated by them after receiving it from a raw material manufacturer, and they can consistently get it, I can tell you that those companies will never fail.
Right. So that covers the next
Because
question.
Nutra
answer.
is by choice.
Right.
You will only buy it again and again if you like it and if it makes a difference.
Works.
I can tell you a typical example of a toothpaste.
Mm-hmm.
Any toothpaste that you take, if it does not give you mouth freshness, teeth white ho rahe hain, nahi ho rahe hain, bahar mein jaye. It needs to give you feeling
Right.
and the freshness, because that is what you're doing morning brush for.
Right.
The toothpaste quality is judged by what feeling you are getting in your mouth by the consumer. And if you get the right feeling, you will love it, you buy again. If it's too basic, doesn't matter how much fluoride they added, or maybe the basic one has cleaned your teeth and made it whiter, you will still not buy it. I will get maja nahi aaya. So Nutra is by choice, and brands will only be successful if they buy the good quality ingredients and the product really works. Product will only work if you put in something good.
Right. So, can you explain in 3 words 3 things every consumer brand must stand for?
So the consumer brands should, I think, the how the trend is moving, the ease of taking supplements.
Okay.
We are all in a
Convenience.
busy world, right? So for the ladies, they need to understand the consumer behavior,
Mm-hmm.
then launch their pack sizes, the formats, for example, and the delivery formats. That's very, very important for consumer behavior.
Convenience.
Because ladies, you need to understand in what way they're going to take it,
Right.
right? So that matters a lot. For the males, if they're designing a supplement or consumer brand, for example, they need to understand male behavior, for example, right? And I think the consumer behavior drives a lot of innovation or product style, product type, and product quality for the consumer brands.
Right. How do you stay ahead of the trends?
Innovation.
Innovation. One space you don't want AI to enter into your industry. Anything?
I cannot think of anything. I mean, I, as an owner of the company, in fact, I have empowered my team and all the HODs to come back to me and the management that what changes and how the AI is being implemented in HR, in a QA, in formulation, in innovation, in a factory. I think we want to be ahead in the game, And that's what we have done as a company or as a leaders, given the empowerment to the HODs to ensure that they implement some kind of AI in the department to
Okay.
ensure, I mean, accounting and HR are the very labor intensive department. So that is there we are implementing, for example. AI does things lot faster than human beings can do. So implementing that is a great choice. I personally did not notice any, as of now, any hiccups where I should not implement in some vertical, but I'm pretty sure if I stuck up something that I'll try to avoid it.
Okay. So, given the global uncertainty, how should business navigate this phase? They should focus on survival or innovation.
They should focus on innovation, but as long as innovation is happening, resilience and sustainability. If you want to sustain these global things, global disruptions, whether this is a war, this is a COVID, this is a trade war, or whether it's actual Iran and America war, if you want your business to be sustainable and you really want to fight back, then it all depends on how resilient you are as a business.
Right.
The resilience can be built into manufacturing, supply chain, people, mindset, and how sustainable your processes are. I think if you focus on resilience and sustainability, automatically you will phase through anything.
Right. Next question is interesting. If you were in your 20s today, what business would you build?
Nutra.
Okay.
I did build Nutra in 20s anyway.
Yeah, I know. I mean, this question is actually, but I'm saying now, since those 20s was different, this situation is
I
different.
mean, I
Or
may
you
build a
are like-
D2C brand, but I'm very much happy building innovation, because I think even the brand owner is nothing and nobody if they don't have access to innovative branded raw materials. So even the D2C brand owners cannot do anything if, I mean, we are the inventors, right? I mean, I feel very proud to be in this business.
Right.
If I don't bring innovative raw materials, there'll be no formulation for you to take from Blinkit or Swiggy or Instamart or Amazon.
Right.
If I get the innovation out, then the innovator and then the formulator will put into a tablet capsule. If I don't give you innovation, there'll be no brand.
Right. Okay. Next question is, what will next 5 year look like for India?
I think next 5 years for India already started. I think next 5 years is going to be a lot of consolidation, a lot of cleanup of the brands. And I think the brands who are built on the quality and quality of ingredients, they will survive, they will grow very well. But the brands where the people are taking shortcuts, and I think overall, when I spoke to a lot of founders, a lot of brand owners, a lot of DTC brand owners, everybody is very conscious about the product quality now. I have also seen brands where they were too busy looking into the quality of raw materials, and that's the whole story and whole truth about building businesses. I speak to a lot of founders, promoters. Hey, yaar, Gaurav, we were too busy building the brand and selling things. We never really focused on the raw materials. But अब हमें पता लग रहा है यार कि we were not buying the right quality. All rubbish was coming in. We are very very stressed and tensed about it. But now हमें immediately हमें clean up करना है. We really want to do everything the right because now we built a brand and it's too risky for us. But looking at that thing where 5 years happened, a lot of brands has gone through this phase where they never really focused on the quality of raw materials. They just been busy selling, did not even ask kahan se aa raha, kya quality hai, validation nahi ki. A lot of brands now started looking into the quality.
Right.
Existing brands. But the good thing is the new brands which is coming in, they are starting on day one.
True.
I am seeing brands who are starting up every day. Like I meet founders, promoters, so many I have in my mind also. Day one, they're asking, man, look, quality of ingredients. I want the top quality.
Wow.
And you give me the lab reports. Tell me how do I validate it? I don't trust you. Tell me how can I validate when it comes to me? That is starting now.
Wow.
So whatever brands is going to come in the next 5 years, the new ones, they are already going to be resilient because they already know what mistakes others must have done.
Right.
And they are fixing it from day one. And the brands who are already maybe 1,000 crore, 500 crore, 600 crore, 200 crore, 150, 100 crores, they are doing all the cleanup. They are being responsible. And I think that's where I'm very happy that there is a big room for people like us who can really work with the brands. And those people are ready to pay the price.
Right.
They're just saying, okay, price will work it out. Give me the quality first.
So, with this extensive experience of manufacturing and innovation, what are those three mistakes you want ingredient manufacturer not to do to survive or not to fail?
I think ingredient manufacturers, we should all take the ownership of educating the industry. See, making money is important. Building businesses are important. If there is a mistake, own it. Take ownership. Don't do it again.
Correct it.
In business, shit goes wrong. I can tell you that.
Right.
Mistakes will be there. Weaknesses will be there. Incidents will be there. Nobody can tell that, hey, look, I can drive on the road and not have an accident. It's going to be an accident. It's fine, right? But don't do the same mistake again and again. As an ingredient manufacturer, I think if we know there has been a flaw, fix it. If we don't fix it, it's going to hit you back again. So I'm not saying we are bulletproof or we are incident proof or we haven't made mistakes. We must have made a lot of mistakes, for example, but the intent is right. Right? The intent is to do the right thing, for example.
Right.
And if that is the intent, I think we as a business or anybody as a business will keep growing. Keep growing, and there is unlimited growth in the market. And market is not just for India, whole globe is there.
Right. So you do believe that the platform that gives right information, that spreads right information, that connects people are needed.
I think a lot of it is needed. I mean, there are some platforms already in D2C space, but there are not many platforms which are talking about the ingredients.
So Changemakers fits into it?
Changemaker has started, I think. I mean, you must have done 2, 3, 4 blogs, I believe, and identifying the right people or the companies to really get the knowledge out. And I think it takes a lot of courage, like the kind of information I'm giving you.
Yeah.
It takes a lot of courage and a big heart to share all this information.
Right.
Otherwise, you know what people do? Man, I should not share too much. If I educate my consumer too much, he will be asking the same question from me. Usually, typically, that is a scareness, right? But if I don't educate, somebody else will educate, or consumer will get educated themselves. So knowledge is all about sharing. If I'm educating my consumer, if I'm telling 10 things, for example, and if I'm selling a product to you, and if I'm not able to give you those 10 quality parameters, but I can give you 9, you will still buy from me.
True.
Because you will just say, Gaurav, I like it, you are transparent, you are honest, you're doing all these 9 tests, 10th you're not doing it, but still I'm confident the 9 I'm getting.
Right.
Where somewhere else I'm doing it, he's not giving me 1. He's not even telling me the truth. So I don't want to go with that person or the vendor. I want to go with you still. So educating consumer is not a bad idea. It's a good idea. But you can only educate if you're doing the right thing yourself.
Right. So Changemaker also with Madhuri, Changemaker with Madhuri, this platform we are designing in such a way that we're not focusing on one stakeholder of this health industry. We are trying to bring multiple stakeholders like ingredient manufacturers, like brands. How does brand look at ingredient manufacturer? How do ingredient manufacturer looking at brands? What are their expectations? Then we are also bringing informed consumer from the this space health industry, so that they all are on one platform and they share the ideas and the information is circulated in the right space, so that a right product will come easily to the market. I think that's why that's the vision of Changemakers with Madhuri podcast. So I hope you enjoyed this.
Very much enjoyed it. And
I couldn't realize the hours. I mean, I think it's almost 2 hours we are sitting and talking. I think there's a lot to discuss. There's a lot to know. There's amazing information you have been sharing. And I loved it that you didn't hesitate to share your USPs, your, uniqueness, how you have been building this, how you are different. That's a rare quality what I've seen from Indian side.
Thank you.
Thank you so much for coming. We enjoyed it a lot, and hope to see you again.
Thank you, Madhuri. We'll keep talking and keep giving education to the consumer and the brand owners.
Right. Thank you.
Thank you.
Chalo.